Hi, I'm Jean Schumacher, founder of the Weight Loss Advantage, where I help people to lose 50 to 100 pounds without dieting. You can find my website at www.weightlossadvantage.co. Couldn't get the co. And I also have a website, simplyplantbased.net, to help people transition to a plant-based lifestyle. Lots of great resources. And coming in January of 2020, we have the Pregnancy Advantage to help women get pregnant ready. And I have the privilege and honor of interacting with Dr. Robert Ostfeld, who's the director of Preventive Cardiology and is the founder and director of the Cardiac Wellness Program at the Montefiore Health System. He's the associate professor of clinical medicine at the Albert Einstein College of Medicine. He earned his master's in epidemiology from Harvard School of Public Health, an MD from Yale University School of Medicine. He's board certified in internal medicine, cardiovascular disease, echocardiography. Wow, on and on. Doc, wow. It's a pleasure and a privilege to be with you here today.
Oh, well, thank you so much for having me, and thank you so much for that incredibly generous introduction. It's a real honor to be here with you and your audience. Thank you.
Well, before we dive in, you have this incredible this whole archive of plant-based wellness living in the Journal of Geriatric Cardiology. And before we dive into that, you have a program that's coming up at Montefiore on November 2nd. And this is the 3rd annual conference. And if anybody out there is listening, this is an amazing conference. So take it away, Doc. Tell us about this.
Oh, well, thank you so much. We're really excited about it. Yes, our 3rd annual Montefiore Einstein Preventive Cardiology Conference on November 2nd. It's a full-day conference, and it's basically about plant-based nutrition and cardiovascular disease. And it's open for everybody. And there's also going to be continuing education credits for physicians, for nurses, for RDs. We're really excited about that. And there'll be just such incredible speakers. The food will be all plant-based, and a lot of the people your audience knows well will be speaking. Dr. Caldwell Esselstyn, Dr. Danielle Bellardo, Dr. Michelle McMacken, Dr. Walter Willett, Dr. Tang, Dr. Khan. We're going to be discussing all kinds of aspects of nutrition and health, and diving into some really, really cool areas. As your listeners well know, the microbiome is just a burgeoning area. We're having a world leader, Dr. Wilson Tang from Cleveland Clinic, come. He's the TMAO guy, like the TMAO guy. It's awesome. And then there's this whole other new burgeoning area in sialic acids that it seems to make red meat particularly unhealthful. And there's this wonderful doc from San Diego, Dr. Gorse, who's going to come, who's a world leader with that and speaks to us all about that. So we're just so excited about it, and we would love for you all to come. One thing to know is that we're fortunate. We did sell out the last 2 years, and once we sell out, I can't have anyone else come in. I feel bad. I get these emails and texts from friends or whatever. They're like, "Oh my God." I'm like, I can't. Like, once we hit the fire limit code thing, that's it. No more.
Well, if anybody's interested, and I'll post the information down below. And we talked about this in the other interview that I did with you just recently. It would be helpful if you can record this, and we talked about this, and a lot of this you do on a shoestring budget, because although you're doing it under the auspices of Montefiore, you have to do a lot of the funding yourself. And I know you do this on your wellness program. We're going to talk about that in a minute. But if anybody can help donate and give, especially to help record this, because I know when I came out, I've been there for the last 2 years, and oh my gosh, it is so amazing. Honestly, this program is incredible. But I'm at the end of the day, I'm just like, I'm just like, my brain can't handle. There's just so much research and information that my brain is just like on sensory overload. And it would be really, really helpful if we could get it professionally recorded. But I know you're limited in terms of your budget, because a lot of this comes from just donations. So if anybody can help, and please, I'll put information below how you can help support this. So if anybody out there can help, please do, because a lot of the stuff that Dr. Ostfeld does at Montefiore is on a shoestring budget, and a lot of it he donates himself. So like your wellness program, like you give up your Saturdays once a month to do this, and you're there all day long helping people. to do this program. Tell us about this and all the other things that are going on at Montefiore.
Oh, well, thank you so much. I feel really lucky to be part of Montefiore. And, you know, we have an outpatient arm of our program, an inpatient, an educational arm, and a research arm. And the outpatient arm is when I see patients in clinic and we weave plant-based nutrition to every visit. We have an infrastructure for them. We give them handouts. We work with them on it. We have them come back every 6 or 8 weeks for blood pressure checks, weight checks to help them along the way. And a key part of our program is we have these Saturday morning sessions that are about 4 or 5 hours long, where I speak, a nutritionist speaks, we serve lunch, and we take a deep dive into the how and why of plant-based nutrition. We encourage people to come with a friend or significant other to help them along the way. We don't charge patients for it. I fund it all through donations. We, you know, where Montefiore is, there's a very large indigent patient population. And if I were to charge sometimes even $5 for our Saturday morning session, that would be a rate limiting step for people. So we really want to democratize this information as much as possible. And that's part of where these donations make a huge difference. And it enables us to keep going and to do more and more stuff. And they are tax deductible. So thank you for bringing that up. And so we have the outpatient arm. We've had thousands of patients come through over the years. We have an inpatient arm as well, which is somewhat newer, a few years old now. And, you know, I used to walk in the hospital and I would go in a patient's room, rounding, and, you know, and I'd go rah-rah plants, and then I'd leave, and 10 minutes later, dinner served, and it's chicken. I'm like, oh, totally undercut. So I'm like, this isn't working. And so we met with the head of food services and nutrition, and one thing led to another. And we created a whole week's worth of menu, plant-based menu for inpatients. So now you can order plant-based meals, breakfast, lunch, and dinner for the inpatients. It comes with we're so excited. It comes with a handout, and we have forks over knives playing on continuous loop on one of the inpatient TVs in Spanish and English.
That to me is just amazing. That right there. I mean, because when you see that, how can you argue? How can you argue with that?
It's terrific. So now I can go in the patient's room, go rah-rah plants, order the meal, they get the handout, they can watch forks over knives. It's like super helpful.
Right.
So that's just amazing. And those meals are now served in the hospital cafeterias, and they tell me it sells out, which is like awesome. And then, so that's sort of like the inpatient arm in a nutshell. Then we have an educational research arm, and I guess the flagship part of the educational thing is our conference, the annual conference. So hopefully y'all can make it, and we'll dive into much more detail about all of this. And we also have a variety of research initiatives going on as well, which we're really excited about.
It's nonstop. Well, in this article, you wrote about hypertension and heart failure. So let's start with, what is hypertension?
Hypertension is high blood pressure. Now, you guys probably all remember, you go to a doctor's office, they put the cuff up on your arm, and they give you a top number and a bottom number, like 120/80 or something like that. The top number is the pressure in the blood vessels when the heart squeezes, and the bottom number is the pressure in the blood vessels when the heart relaxes. And we need blood pressure. You have to have some, because you've got to pump the blood to your brain and to your legs and to your toes. So we need some, but you don't want too much. So high blood pressure is when it is too high. And we call high blood pressure the silent killer, because you don't feel it, so it's silent, but it can kill you. And there's the Global Burden of Disease study. It's a phenomenal study, and they look at globally, what are the things that are most likely to cause death? Well, let's see. Number one, high blood pressure. It is a really, really serious problem. And the good news is there's lots of wonderful ways to identify it and treat it. And it is, unfortunately, obscenely common. Like 1 billion people worldwide have it.
Why is this such an epidemic?
Well, I think largely it's lifestyle related. And there are some genetic causes of high blood pressure, but those are by far the exception, not the rule. And I think it is largely lifestyle related. And a combination of the sedentary lifestyle, more Western diet. When you look at indigenous populations that are more active and eat much more plant-based nutrition, they have substantially lower blood pressures. If you look at a variety of population studies across the world, more plant-based nutrition people eat, the fewer animal products, the lower their blood pressure is. And we know that switching to a healthier lifestyle, which includes more plant-based foods, can lower blood pressure. So I think it is primarily driven by unhealthful lifestyle, but there certainly are meaningful genetic contributions to that your physician can help to sort out. And in the US, something like 100 million people have high blood pressure. So look to your left, look to your right. The person sitting next to you probably has high blood pressure.
Oh, gosh. Well, what is the first line of therapy in your practice at Montefiore?
First line of therapy in my practice, and I hope most everybody's practice, and this would be guideline supported, is lifestyle change. Now, unless your blood pressure is through the roof, it's lifestyle and medications. But if it's not through the roof, the first line therapy is lifestyle change. That is basically eating more healthfully and exercise, which is, we don't really tease those out. We just do both. But there's a little bit of data to suggest that diet may have even more meaningful impact than exercise, but it's not clear. We just do both because they're both critically important for blood pressure health, but also health in general.
Right. Well, who's Walter Kempner? I've heard a lot about him and the rice diet and what he did.
Walter Kempner is this like amazing doc who was like decades ahead of his time. He was like at Duke in like the 1930s, and there was basically nothing to do for high blood pressure then. It was quite deadly. And what he did is he put patients on a rice and fruit diet. A very low protein, very low salt. That's what he did. Put them on that diet. It would probably make people who promote a low carbohydrate diet blow up. But that's what he did. And he had unbelievable results. Many patients reversed high blood pressure, reversed the damage that the high blood pressure did by the metrics that they had of the day. If you're looking at EKGs and X-rays, really remarkable stuff. And so that's who he is, an incredibly interesting doc at Duke in the 1930s who's doing some pretty cutting edge stuff.
Well, in spite of the success, why do you think Kempner's work was not widely recognized?
Yeah, I don't know exactly. I think it's because, he didn't have the gold standard randomized controlled trial. But there were, so some people didn't necessarily want to embrace it. People, it's sort of the usual stuff that's even coming around today. Well, I don't think my patients can do it, or I don't believe in it, and also he did, I don't know how true this is, but I read this, like he had some interesting tactics to help people stay compliant. Like I heard he whipped patients. We're not allowed to do that these days. So I don't, I don't know if he did that, but these are anecdotal reports. But anyway, so I think it's really comes down to, it was so radical. What is that people just sort of laughed it off, or there wasn't a lot of data outside of what he was doing. So it wasn't part of the vernacular, the culture. It was so different. It just didn't take off.
Well, there is what's called the DASH study, the dietary approaches to stop hypertension. Walk me through this.
Yeah, that's an incredible study where they were looking at exactly that, dietary approaches to stop hypertension. And there's a DASH diet, which is largely vegetables and fruits and a little bit of animal products, low-fat dairy, fish. And it was actually originally designed without animal products. But they're like, well, they just didn't think that would be palatable to the general public, so they just put some in. So it's interesting kind of backstory. But at any rate, there was this randomized trial published in the New England Journal of Medicine, I think in 1997, where they looked at about 400 or 500 people, and they had 3 diets: a control, which is basically a typical Western diet, then like kind of typical Western plus more vegetables and fruits, and then the DASH diet, which had tons of vegetables and fruits and far fewer animal products. And not surprisingly, the DASH diet, the one with way more vegetables and fruits and fewer animal products, had the most reduction in blood pressure. Right. And the one that tacked on some additional fruits and vegetables, they kept the weight and sodium the same. The one that tacked on more fruits and vegetables, they had intermediate results, and the control had the worst results. So the DASH diet, that's really formed the foundation of dietary advice for people with high blood pressure now. The DASH diet is really the first line one because of that study.
Wow. Well, there's another one, the coronary artery risk development in young adults, otherwise known as the Cardia Study. Walk us through that.
Very interesting prospective cohort. It's not a randomized trial, but in that study, what they did is they looked at, I think, around 5,000, 6,000 young people, followed them for 15, 20 years, and had a whole bunch of data points along the way about diet, and do they have disease, do they develop disease, what do they develop, of all sorts of metrics. And basically what they found, that is when you eat more plant-based nutrition, you are less likely to develop high blood pressure, and more animal products, it's more likely you were to get high blood pressure. So, you know, it's a prospective cohort. So it is hypothesis generating, but very, very fascinating study, and lots of incredible data has come from the Cardia Study.
Well, there was another study done. What results do we see from the European Prospective Investigation into Cancer and Nutrition, the Oxford study? How did these results differ from like the Cardia Study?
Very similar. It's a great question. And the EPIC study is an incredible study of many, many people looking at nutrition and risk, diet and risk of future diseases, another prospective cohort. And basically what they found was the more plant-based people ate, the lower their blood pressure.
Oh, what a surprise.
I know, shocking. The more animal products ate, the higher their blood pressure was. And that is, of course, also supported, that's in Europe. If you bounce to the US and Canada, the Adventist Heart Study, which looked at Seventh-day Adventists, the religious organization, they treat their body like a temple. But even in that population, those who ate the more plant-based, they had lower blood pressure. Those who ate a vegan diet had a lower blood pressure than those who had an omnivorous diet. And interestingly, in the Seventh-day Adventist study, those who ate a Western diet, they really treat their bodies, that group, they treat their bodies like a temple. They ate a much more healthful Western diet than a typical Westerner. And in the EPIC study, to the flip side, those who ate a vegan diet ate, on average, not really a whole food plant-based one, but there was a little more junk food vegan-y in there. And we know that's because they had lower rates of fiber intake. But despite that, they were still seeing lower blood pressures. And despite the fact that in the Seventh-day Adventists, those eating the omnivorous diet had a much more healthful one than the average Westerner, those who ate a vegan diet had an even lower blood pressure reading. So it's really quite impressive and quite consistent from randomized trial, supporting it, to a variety of prospective cohort or cross-sectional analyses, supporting it as well, and backed by multiple kinds of mechanistic reasons, from the plant-based diet having more of an antioxidant capacity, reducing free radicals, reducing reactive oxygen species, which can be damaging and stiffening to blood pressure, which could raise it up. Their anti-inflammatory effects through a variety of steps, which can also help blood vessels relax more. It is, of course, the plant-based diet with more fiber is more healthful for the gut microbiome, which can reduce trimethylamine oxide levels. Yeah, and that promotes anti-inflammatory effects, more short-chain fatty acids. All of these things work together in symphony, in concert, to help us be healthier.
Well, what do you think are the mechanisms by which plant-based nutrition leads to decreased blood pressure?
Well, I think it's multifactorial. I think when you eat this way, one sort of more simple one is that it's just generally lower in salt, and very high salt diets can raise blood pressure. There is the beneficial impact on the gut microbiome, which can be anti-inflammatory, and by creating more short-chain fatty acids can help the health of blood vessels, help insulin resistance, and may even downregulate cholesterol formation, which can be also helpful for blood vessels, help them relax. It can oxygen gives us life and takes it away. So we have to metabolize oxygen, but some of those products, the byproducts of that, are free radicals, which could be damaging, stiffening to blood vessels, stiffening to the heart, raise blood pressure levels. But plants are enriched in antioxidants and can help to scavenge those and minimize some of the damage of those effects. And one of the ways that comes up quite tangibly is in athletes, if you work out a lot, you can get sore the next day, and it's called delayed onset muscle soreness, and that's felt to be mediated largely through free radical damage and stress on the muscles. So when people eat dark leafy greens or beets, that delayed onset muscle soreness happens less. You can train more frequently, and actually like beet juice around the time of the Olympics, like you couldn't get it anywhere because like all the athletes ordered all the beet juice for that exact reason. It also it may be able to help improve athletic performance too by improving the efficiency of the mitochondria. That's the thing, like these helpful dietary patterns or foods, yeah, you know, maybe it's lower in salt, but but you know, by the way, it's anti-inflammatory and it's antioxidant and it's good for the microbiome and it may lower cholesterol levels. It's just multiplicative, and these things all work together in concert to protect us.
You are always just an amazing fount of knowledge and a wealth of information, honestly. And I hope if anybody out there can join us at November 2nd at Montefiore in the Bronx. There's an amazing conference. And I know when we talked last, you said there wasn't a whole lot of tickets left. So if people are interested in going to this, you really do need to get your tickets as soon as possible, because once they're gone, they're gone. And I think you had a wait list of several hundred people last year. So
yeah, it was big. It was big.
I know. So if you can get your tickets as soon as possible. Also, if anybody can help fund getting it recorded, that would be amazing. So I'll put the link there. But as always, Dr. Ostfeld, so thank you so much for joining me today, because your information is incredible.
Well, thank you. It is an honor to be here with you. Your work is incredibly inspirational, and I'm really grateful to have the opportunity to connect with your audience.
Oh,
thank you.
Well, as always, and I will see you soon at the conference.
All right, excellent. Thank you.
Take care.